Hey guys, Dr. Coral from Renew Health and Wellness here. My little one's taking a nap, so I figured I would chit chat a little bit about Monjoro, Ozempic, semaglutide, and just some tips. So first and foremost, everyone always asks me about dosing. Here at Renew Health and Wellness, we really customize our dosing based off of the patient needs. So I always say that the biggest things that we really want to do is maximize benefits while minimizing side effects. So how we do that is essentially we start off on the lowest dose, which we generally is about 0.25. Sometimes we go lower depending on patient preference. And what we're trying to do is we are trying to continue that dosage as long as we're having good results. Now, that may mean that we need to go up every 2 weeks. That may mean that we go up every 4, like the manufacturer generally recommends, or it may be, 6 to 8 weeks, just depending on how patients are responding to that. And the reason why we do that is because side effects, we're building up that medication in the body. So therefore, if the body, if the semaglutide half-life is like every 7 to 10 days, and you're getting this injection every 7 days, then what can happen is you can start to really build up the medication in the body, and after maybe 2 or 3 or 4 weeks, your side effects may really increase. Sometimes patients have the worst side effects the first week, and then sometimes it's not maybe until week 2 or 3 or 4 before you really start having the side effects. It does take about 4 weeks for it to really build up in the system. So sometimes it can take that long for it to really start working. Also, what we're looking at is for Monjoro or tirzepatide, you're looking at about 20% of your body weight as far as loss. And then with semaglutide or Ozempic, just in studies, they say about 16%. So you can kind of get an idea. You may not lose as much if you do have issues with sleep, stress, toxic burden, or hormonal imbalances. So we always like to try to address those because that's really, really important with a weight loss program, is resistant to weight loss. If you guys are worried about side effects, don't worry. I have a lot of different medications, but also supplementation that will help with those as well. We try to prevent those side effects, like I said, by helping reduce the dosage to make sure we are maximizing those benefits, but we can also preload with those with magnesium, slippery elm bark, all the different types of things to really help with that digestive system. When you have constipation, which can be a side effect of this, we also want to think about hydration, but that also can cause nausea and also gas, but also more burping and also indigestion as well. So we really want to think about, all right, what is the cause of these side effects and how are we going to prevent those? If you guys have any questions for me, feel free to reach out and we'll talk soon.